Hi, this is Dr. Roadhouse, and we're checking back in with Sandra Henderson, and she's got autoimmune thyroid, and she also had a very bad head tremor and left side tremor. So we checked in with you a little while ago, and you're doing better, and we just wanted to check back in with you because you relayed some pretty good news today. So why don't you just, describe how you're doing and what's improved, and what do you think your improvement is?
Well, I think I've probably improved halfway. I'm really happy. I'm moving around a lot more than I used to. This leg is working a lot more.
Yeah.
So, I mean, my mobility is better.
Well, just kind of describe, in the first video we talked about how you went to all the different doctors and all this stuff, and they said hernia, and they said, back problem and all this stuff. But explain where you were when you first came in, where the pain was, how you didn't have any strength, and the leg pain and all that.
The pain was right down here in my right hip, and it would stress down into my leg. And I've had a hernia here, but they kept doing research on the hernia, and they never could find anything that it was damaged again. And you started treating.
Okay, so talk about, like, when you talk about going down your leg, I mean, was it, could you put weight on it when it was real bad? I mean, how was the pain?
No, I couldn't.
Could you alleviate it?
It was a sharp pain. It was a sharp pain inside my leg, and I actually could not lift my leg.
When you first came in, you could not go like that.
Right.
We couldn't even do the muscle test on you because you couldn't raise your leg up. And then you were having symptoms back there too. And this is all on top of all the other stuff that you had.
Right.
So we've been doing the decompression on the 2 discs in your lower back. Okay, so that's a lot better. Your mobility's better. Your strength is better. You can raise your leg up now. So when you came in, the pain was there 24/7.
Yes.
Okay, 7 days.
Yes.
How often do you get it now?
Intermittent.
Yeah.
I mean, not all the time.
Yeah. And when you do, what's the level of pain?
Alleviated. Probably 5.
Yeah, and where it used to be a 10.
It used to be an 8 to 10. Yes.
Yeah. Okay, good. Okay, so then talk about the energy, the sleep, the head tremor. I mean, obviously you're not seeing it at all.
My head tremors are a lot better. Before, I did not even want to get out and hardly do anything just because of the tremor in my head and my leg situation. So, but now the tremors are a lot better, and I'm feeling more confident into getting back into the routine that I used to have.
Okay. Now, what about sleep and energy level? I mean, is that improved yet?
I am, sleeping is better. I still have my rough nights, but we're getting there.
Okay.
We are.
Well, I mean, when you came in, you were in really bad shape, and you've been to all these different doctors. So we're about 8 months right now. I told you it's going to be about an 18-month process because of the autoimmune, the disc problem, the leg, the tremor. You had a lot of stuff going on with you. We're working on the leaky gut, and that's going to help with the blood-brain barrier. And you're getting the nutrients to the brain now. And we've been doing all of the oxygen and all the cerebellum and the brain activations.
Eating gluten-free.
Right.
We've done that.
We did the genetic testing, and she has the gluten gene, so she can never eat gluten again. It's not like a peanut or a shellfish allergy where you blow up. It was doing damage over years, and none of the doctors could. And we had all those other tests, the cross-reacting foods that we found, so she's been doing really good on her part. That's why when patients come in, we talk about the commitment levels, because it's not easy doing that, but you've got a very supportive family.
You've got to keep it up. You've got to keep pressing on it.
You want to tell them about...
Some days you're going to have really bad days and you don't feel like you're getting any better, but just keep going and it gets better.
We had 3 months where there was, and I told her, this is not something that's going to get better overnight. It takes some time. But tell them, like, when you... I can't remember if it was July 4th or what, when you actually ate some gluten. Kind of tell them what happened.
Yes. I ate some gluten accidentally, and I got really sick. I mean, it was more of a sick headache. Oh my gosh, my body froze up, my hip hurt. I mean, everything hurt. And I was shaking really, really bad. And I knew right off immediately that I had eaten something wrong.
because you'd been keeping that in your diet, and that's when you came in, and even your mom came in, and they're wanting me, you know.
And I don't hardly have any headaches
Yeah,
now.
yeah,
I mean,
you're doing-
those have really calmed down a lot.
So
Yeah.
you're really making good progress and stuff,
I
and we're
am.
about halfway there, and this is tremendous improvement. So we'll check in with you, you know, in a couple months or so, and keep everybody updated, because I want them to see your progress, because you're really, you know, a tough case, an
Right.
interesting case, and have a lot of different things. Some people come
Yeah.
in for just the low back, discs, and the legs. Some people come in for just the thyroid. Some people come in just for the migraines.
Yeah.
Some people come in just for the head tremors.
And
you
I
had
had
all of them.
multiple things.
And you know how I like difficult cases and stuff. So anyway, we're going to check back in with her a couple months and see some more progress from her. And probably by then you're going to be able to exercise, and have you lost any weight yet?
Yes, I have a little bit.
Okay.
Yes.
But that's
yes.
better than nothing, because you haven't been able to lose any weight.
Exactly. I was gaining weight because I couldn't get around very well.
Right. Yeah. Okay, so we'll check back with her. Thanks, Sandra. You're doing awesome.
All
Keep
right.
up the good work.
Thanks.
Mhm.